This is case of the day, and we are on case 137th. This is Tuesday, and the title is Validation of the Scab-Like Sign. I did speak about this in case 16 a few months ago, and I'll come to that in a minute. So, this 29 years old had a past history of treated TB, presented with fever and weight loss in July 25. And this was the appearance: post tuberculosis, lung disease, right upper lobe. And if you see the top right, I have a link to a post I had done on PTLD. Now, the rule is that in old cavitary disease, always look for intracavitary soft tissue. And most of the times, you'll see fungal balls, as in these two cases, where both these patients had rheumatoid or had underlying disease. The case 66 had rheumatoid arthritis with secondary colonization by aspergillus and cavitary aspergillosis. But not all patients have obvious fungal balls, and that was what case 16 was about, where we had this nodule along the wall, which is the scab-like sign, which was first published in 2018 and then retracted because the authors had fudged the ethics clearance. But the contents were not challenged, and that does remain. And while the paper talked about how it predicts hemoptysis, the fact is that it fundamentally points towards the presence and likelihood of chronic pulmonary aspergillosis, whether you call it CPA, CCPA, that depends on the underlying substrate. And so when I looked at the patient, you see this irregular nodular soft tissue arising from the posterior wall and along the inferior aspect here. And almost looks like the waves, like a water lily sign, let's say, of a hydatid. But this is your classic scab-like sign. So we mentioned this in the report. The patient had a bronchoscopy in a week's time, and aspergillus hyphae were found on microbiology. Patient was put on voriconazole and came for a follow-up CT yesterday, and we can see that the scab-like soft tissue is completely gone. The patient has gained weight, is improving, and the cyst has increased, probably as a rebound reparative phenomenon. So here we have a case that not only we saw a scab sign, the patient was proven to have pulmonary aspergillosis on treatment, and the scab has gone away, telling us that the sign works, and it does work in practice. By the way, you can also gauge weight gain on CT. So if you look at the scaphoid abdomen of cachexia with no subcutaneous fat, there is now increase in subcutaneous fat, and the scaphoid nature has gone. So just one of those by the way things you can do with CT when you just look at the lower images. So just to summarize, the scab-like sign helps us pick up chronic pulmonary aspergillosis early in patients with old cavitary disease. And I think it's worth the time spending that extra 30 odd seconds telling ourselves, okay, patient has a cavity, let's look for soft tissue within or along the walls, and then mention it in the report. The RAD Protect schedule, my WhatsApp channel. Thank you so much for viewing this.